If the kid had the arthritis and had some inflammation to the iris, how would that be handled?
Well, the inflammation to the iris, there's usually white blood cells floating around in the child's anterior chamber. What we usually have to do is treat the child with topical steroid drops. Usually also we want to make sure that there's not enough inflammation to cause what we call synechii, which are adhesions from the lens to the iris, which can cause glaucoma, can also cause cataracts and damage to the lens. So we would first start using topical steroid drops, which are fairly easily instilled, and we'd also use dilating drops to make sure that the pupil is not stuck to the lens capsule. At that point, if the child's under control, it's usually enough. If they need further care, sometimes the child can actually have to take something like methotrexate, which is an oral medication.
Can it affect only one eye or always affects both eyes?
It can affect just one eye. Oftentimes it is bilateral though, but we're certainly more concerned just treating the condition, whether it be unilateral or bilateral.
If one eye gets severely damaged, can they lose vision?
They certainly can. If it's a cataract that we're talking about, the cataract can be removed. We certainly don't want it to get to that stage. If it's synechii, which are adhesions from the iris to the lens capsule, or adhesions from the iris to the patient's, what we call the angle of the eye where the actual fluid drains out, it could cause glaucoma. Glaucoma can sometimes be very difficult to treat in severe iritis and chronic iritises. So we certainly don't want it to get to that stage. That could potentially cause irreparable visual deficits.